The answer is probably not. Obstructive sleep apnea is a disease caused by single or multi-level collapses at vilopharyngeal, oropharyngeal, hypopharyngeal or laryngeal level. So this means that the correction of nasal obstruction might help in the restoration of nasal breathing, but might not be enough for the correction of upper airway collapsibility. This kind of examination is a fine and elegant method for phenotyping our OSA patients. This might help us in understand when the collapse happens, and so it could be a viable option to select patients for alternative treatment to CPAP. Furthermore, this method is useful in the evaluation of treatment failures. The two most common techniques described in literature are certainly transoral robotic surgery by means of Da Vinci system or base of tongue reduction by means of coblation, the radio frequency plasma system. There are several techniques described in literature, but the most spread worldwide are certainly expansion sphincter pharyngoplasty by Tucker Woodson and Kenny Pang, lateral pharyngoplasty by Michel Cali, and finally barbed repositioning pharyngoplasty by Claudio Vicini. Probably, in patients without recurrent tonsillitis, tonsillotomy, described as intracapsular tonsillectomy or tonsillar reduction, is a valid and viable option. Patients affected by obstructive sleep apnea might present with multi-level collapse of the upper airway. So the question is, should we perform multi-level surgery in a standalone procedure, or should we delay the surgical corrections in multiple stages? The answer is still not clear from scientific literature, but evidence shows us that multi-level surgery in a single stage appears to be a promising, valid, viable and feasible option. Upper airway stimulation is probably the most recent development in the treatment of obstructive sleep apnea. It consists of the stimulation of the hypoglossal nerve in order to correct the hypotone of genioglottal muscle. The responder rate average described in literature is around 75%. There are 3 systems approved by FDA. The most recent research is focused on the combination of stimulation of hypoglossal nerve and ansa cervicalis.